The yoga research team on the celebration of the first ever International Day of Yoga as a continuing medical education program. I also place on record my deep appreciation to this team for actually integrating the very important Indian systems of medicine, considering that this is an allopathic hospital with training in MBBS for allopathic doctors. Concurrently adding yoga is going to be a great example to all the medical colleges to follow, and to be able to integrate this very helpful interventional medical practice into our curriculum of MBBS. In fact, having worked with the Ayush department, although I am not from the Ayush medical stream, I am from the MBBS allopathic stream, having worked with the Ayush department for trying to develop some guidelines to integrate the Ayush systems into the allopathic system, this example of this particular college I will be citing in future very often, that it has set an example as to how we can actually start integrating this into our curriculum. I wish you all the very best, and I hope you will become extremely successful and to be a model for such integration to be used all over the country. So with this, maybe I'll stop this introduction. Let me go straight to yoga and mental health. I can't help if the screen is not going to be visible, because the light is meant to be used for making me visible. I would rather want the screen be visible. Here we'll use some 2 or 3 examples of conditions for which yoga was applied, and some evidence was able to be obtained from research. I chose 3 conditions: schizophrenia, second one is depression, and third, the cognitive failure in the elderly. Schizophrenia, because it is one of the most serious challenge, and yoga could well be another alternative to that answer to that challenge. So I chose these 3 conditions for these reasons, and I am going to quickly run through what evidences were built. And since this is a medical college audience, my job is going to be very easy to be able to convey some of the terms that I have used here, some of the research design that I have used here. I'm not going to a lot of minor details of the research procedure, but suffice to say what the findings are and what the evidences that I want to use to be able to impress you that yoga could well be an integral part of management of mental health conditions and the mental health team in turn. Schizophrenia, one of the questions that I saw on the MCQs which was given on the screen there was schizophrenia, which are the conditions for which research was done most in mental health in NIMHANS. So one of the items included in the answer was schizophrenia, and so I thought I will start with schizophrenia. This was a randomized controlled study, and we had 3 groups: yoga, a positive control group, physical therapy or exercise therapy, and of course a wait list. All these 3 group patients were on outpatient follow-up, have been unwell for several years, and have been maintained and have been doing well on some stabilized antipsychotic therapy. And all of them were continuing to receive the antipsychotic therapy schizophrenia, which is a challenge to clinical the doctors, is cognition, neurocognition and social cognition. Neurocognition, again, there have been some efforts to use medicines, but on social cognition, it continues to remain a problem. In fact, a mother of my patient said, after the illness, doctor, of course, he has been receiving medicines, but he is not the same. He doesn't love me as much. He has no such concern, which he used to have earlier. He is a different person. He doesn't emote. These are the things for which psychiatrists don't have an answer with our medicines. This man is no more, he is indifferent, and he is no more the same person, and isolation starts, and that emotionally pushes the individual to the corner. This ability to recognize social emotions on others' faces is deficient in schizophrenia. And what happens when the yoga is given? The blue line indicates that the accuracy with which they detect emotions on faces, on the images, substantially improves. This is, of course, only a 3-month study, yet it was significantly improved over the course of 3 months of yoga practice. It seems that the yoga helps in ameliorating, to an extent, these improvements happen in schizophrenia, in particular the social cognition. Schizophrenia, or in autism for that matter, has been to use intranasal oxygen for 65 years, and in those people who have had very significant memory problems, hippocampal sizes are even smaller and shrunken. So over the course of months and years, elderly will start losing their hippocampus, it starts shrinking. 6 months of yoga practice. This is an extremely small number of 7 subjects whom we were able to do a before and after MRI scan and be able to. I stop here. I am of course available during the lunch time, and if time permits here, if there are any quick questions, but please send any feedbacks if you have on to this email address. Thank you once again.